right, guys, in this lesson, we're going to talk about red blood cells. So the first thing that we need to look at is that red blood cells are actually measured in millions. The normal range for male patients is 4.5 to 5.5 million. So, and they're measured in cells per microliter. And in females, it's slightly lower, and that's going to be 4 to 4.9 million cells per microliter. And one important thing that you want to think about is that red blood cells make up a percentage of the total blood volume. And we measure that in Hematology, and that's in another lesson. I want you to check that out. But the thing that I want you to remember is that it does make up a percentage of the red blood cells, or the red blood cells make up a percentage of the total blood concentration volume. And that makes sense a little bit later, especially when we're talking about high amounts of red blood cells and low amounts of red blood cells. But just keep that in mind that they actually make up the percentage. So let's talk about the pathophysiology of red blood cells. And the first thing you need to remember is that they are generated in the bone marrow. They're stimulated by a hormone in the kidneys called erythropoietin, which we also call EPO. So you have this decrease in red blood cells. There's a signal sent to the kidneys that say, hey, we are low on these guys. So kidneys kick out EPO. That signals down to the bone marrow, and you have an increase in RBC production. So red blood cells are called erythrocytes, and the young ones are called reticulocytes. And providers are going to look at reticulocyte counts in certain diseases or to see if red blood cell production is actually happening. So you get low red cell counts. We want to make sure that the bone marrow is doing its job and stimulating that RBC production. They're going to look at these reticulocyte counts. With your RBCs, remember their responsibility is to carry oxygen. They're the oxygen transport. So they come over and they've got the oxygen everywhere. That's their job. So what they're going to do is they do this via hemoglobin. They have hemoglobin molecules attached everywhere. There's like 300 per every red blood cell. Hemoglobin also carries other gases, but it has a really high affinity for oxygen. Check out the hemoglobin lesson. It's going to be, there's a lot of good information on it, but check that out if you want to talk about hemoglobin. But since we're talking about red blood cells, we'll get back to this. So red blood cells have a biconcave shape, meaning that they are caved in on both sides. So here's one side. On the other side, it's going to look like this. And the reason it has this biconcave shape is it has a greater surface area, so it could actually increase oxygen attachment. This biconcave shape actually allows for greater flexibility. So if we're trying to get into those tiny capillaries and deliver the tissues or deliver the oxygen to all the tissues that it needs to, that allows for that flexibility. One cool little note here is that every second, 2.4 million red blood cells are made. So we go through a ton of these a day. So let's look at how this plays into our actual lab samples when you're getting blood from a patient. When you get your blood from your patient and you're going to submit the blood test to the lab for your red blood cells, you're going to use a lavender top tube with EDTA in it. Now, EDTA is an anti-clotting additive, and it keeps the blood from clotting. Now, when you're dealing with red blood cells, you're going to want to watch your technique, because technique is so important with this. So in these vacutainers they've sucked all the air out of them, and they've created negative pressure, so that when you introduce your sample into the top of it, it sucks it up. So you have your little syringe with your needle, and basically it's going to just right down, right? Your plunger goes all the way down and it's empty. What happens is if you actually push and you apply force in here, you're going to break down the red blood cells. You're going to create this condition called hemolysis, or this breaking down of those blood cells. What happens is if you break the red blood cells apart, you actually have a decrease in red blood cell counts. If you have a decrease in red blood cell counts, the doctor thinks, or the provider is going to think anemia, which means a potential blood transfusion, which means potential blood transfusion, which means potential risk, and it's not needed, and it's unnecessary, and it's all because this technique was poor. So what I'm encouraging you to do is let the vacutainer do its job. Don't let it break down those blood cells. When I say consider, look at the gauge of the needle you're using or the size of the tubing. If you're using a 26 gauge needle to get or 27 gauge needle to get a blood sample, it's too small. You're going to break those red blood cells down. So use the appropriate size tubing and needles so that you don't get this hemolysis. So what happens if our red blood cell counts are too high or too low? So let's look at elevated red blood cells. Remember I talked about your red blood cells are a percentage. So let's look at our test tube. So we have a test tube right here, and it's full of blood, and the lab techs have spun it down. So this is plasma. This is your red blood cells, and this is your total blood volume. And remember, it's a percentage. So your red blood cells typically, let's say it's about 45%. So what happens when they're increased? Well, if you're dehydrated, that means that the water content is decreased in the plasma. So you're actually going to have this. So the plasma decreases, your red blood cell count goes up. Now this is only going to be a slight increase. It's not a real high increase. It's just a slight increase. Your patient may have a condition called polycythemia vera, and that is a bone marrow cancer. This count's going to go way up. You're going to see a really significant increase in your red blood cells. You're going to also see an increase in your hemoglobin. You're going to also see an increase in your hematocrit. You're going to pay attention to all three of these. But the big one here is this bone marrow cancer saying, hey, we need more red blood cells. We need more. We need more. We need more. And so it just kicks them out and kicks them out. Now, remember that red blood cells are oxygen carriers. It's their job. So if you have an increased need for oxygen, that means you're going to have an increased need for red blood cells. Well, so look at these two. You've got these pulmonary diseases here, COPD and pulmonary fibrosis. These things are going to cause an increased need for O2, which means you're going to have this increased need for red blood cells. So some of your pulmonary diseases are actually going to cause this. What happens if they are decreased? So you have anemia. So there's a condition called sickle cell anemia. So you have your red blood cells. They've got their little shapes, right? Biconcave. But then you have this sickle cell trait where it actually changes shape. It actually looks like this. It looks like a half moon crescent thing. Well, guess what? There's no biconcave shape. They can't attach oxygen. They have no flexibility. Or they can attach like smaller amounts, but it's much smaller amounts of oxygen. So what happens is there's no surface area. They can't do their job. And so you're going to get this anemia. The kidneys also will kick out that EPO. But if you've got kidney disease, guess what happens to your EPO? Your EPO is going to go down. So therefore you have decreased EPO production. Another time that you're going to see decreased red blood cell counts is if you have an actual hemorrhage or blood loss. So we need to figure out what's going on and take a look at our patients, see if they're actually bleeding from somewhere. If you have bone marrow damage, there's a condition called aplastic anemia where you actually have damage in basically the bone marrow becomes scarred. So it doesn't work. You're not going to get any sort of production, and you'll have decreased red blood cells there. In pregnancy, you have an increased plasma volume. If we go back to this guy right here, so there's your plasma. Well, all of a sudden your plasma increases. So your plasma is going to go up. Your RBCs are going to go down. So that's why pregnancy will actually decrease your red blood cells. So if you've got the trauma or the hemorrhage, just go back, look at your patient. You want to stop the bleeding, and you want to go to and find the source of that blood loss. And then you can also treat this with a blood transfusion. That's where those things come into play. So for today's lesson with red blood cells, we looked at the lab values and we looked at oxygenation and how that impacts your patients. So let's recap. Red blood cells, they carry oxygen. They're attached to hemoglobin, but you just need to remember that RBCs equal oxygen because that's their job. And they've got the greater surface area, and they also are flexible, so that allows them to move through those small vessels. Remember that your RBCs are a percentage of that blood volume called hematocrit. If you have an increased RBC, you're going to have decreased total plasma because you have, and those things equal your total blood volume. If you've got elevated red blood cells, you have an increased need for oxygen, or there's an overproduction of those red blood cells. And if you've got decreased red blood cells, you either have some sort of blood loss or you have some sort of decreased production from some sort of stimulus or disease. So that's it for today's lesson on red blood cells. Make sure you check out all the resources attached to this lesson and go out and be your best selves today. And as always, happy nursing.